All right, so we'll go ahead and begin our discharge case conference. This is Kristen over here, and she's a nursing student with me this week. The first patient we're going to discuss is Mr. Potter in room 262. He's going to be going home later today. He was a 78-year-old male who was planning on undergoing TMJ surgery a month ago, but during his pre-op workup, he was found to have coronary artery disease. He underwent stenting on one vessel, and then he was discharged home. He then presented here a week ago with stent restenosis and underwent coronary artery bypass. We are currently at post-op day 7, and I think, Dr. Mayo, that you've signed off on him and cleared him for his discharge. Is that right?
Yep.
Okay then, I've arranged for him to be discharged to home with his wife, and working on the paperwork to get him started on cardiac rehab. So, Landon, could you give us an update, please, on his status?
Patient is stable, vitals and labs look alright. He's recovering well from a cardiac standpoint, but he keeps complaining a lot about taking his meds. Patient and his wife are pretty much ready to get out of here, but no one has done the discharge counseling yet. He's freaking out about his recovery, and he keeps talking about gardening. TMJ is still bothering him. Someone needs to go talk to him.
So are there any interventions that the rest of you have identified during your workup? Joy, let's start with you.
Okay, for occupational therapy, let me check my notes here. I've been working with him on the standard activities of daily living, dressing, bathing. He lives in a 2-story house with his wife who's helping him out with things. He's motivated, but he tends to be really anxious, which gets in the way of his engagement in activities. Besides the TMJ and the coronary issues, he's also got osteoarthritis, so a lot of complaining about pain in the knees and hands. I still need to educate him on his MET level for ADLs, but I've been working on energy conservation training, some stress management, some breathing techniques for his stress. Also, since he's so into gardening, as Landon mentioned, doing some ergonomics with that. And then the thing I still need to do, I haven't been so busy, I haven't had a chance to order and train him on any health equipment, but I think he could use a bath chair for showering for the energy conservation. And then, I just really think as a team we need to focus on his priorities.
What about PT, Julie? Hey, Julie?
Oh, sure.
Mr. Potter.
Okay, Mr. Potter? Okay, let's see. We have been seeing him. I know. We've been working on bed mobility and transfers and stuff, but he just cannot maintain his surrenal precautions. I have to remind him all the time, and so that's really been a problem. But he has been able to get up and walk a little bit more. He's still kind of a nightmare on the stairs. He needs to use the rail and he doesn't. Let's see, follow-up. He complains a lot about his arthritis, and so we probably need to get some PT on board to help him with that pain later. He might be a good candidate for cardiac rehab. And then the TMJ seems to be a real issue too, so somebody needs to do something about that.
Katie, I suppose pharmacy'd like to weigh in on this case, huh?
Well, he should not have been started on the Lipitor. It is not on the VA formulary. If he doesn't like taking his meds or paying for his meds, he's not going to like paying out of pocket for a Lipitor.
So, Katie, I suppose you have some kind of recommendation for which statin he should be on?
Yeah, simvastatin is on the VA formulary, and that would be a good choice. But somebody really needs to talk to him about the mortality benefit of these drugs so he'll stop complaining about taking them.
So, Diane, have you had an opportunity to meet with him?
No, I've been out sick for a couple of days. I haven't had a chance to talk with him, and I doubt that any of our other chaplains have seen him, but from what I've heard, he's probably got a lot going on. Let me see if I can get in and talk to him today.
Hey, Doc, you got any other interventions?
It sounds like that TMJ is just his really big problem, and it's really impacting his quality of life. Someone's just got to follow up with his dentist, whoever that is. Oh my goodness, my phone today has just really been difficult. I don't want him on any non-steroidals. I need to see him in follow-up prior to his surgery. He needs that low-fat, low-salt diet, just all the usual cardiac stuff.
Okay, so, well, some priorities I've identified, I think, are cardiac education with a spouse and rehab, of course, and all that other stuff that goes with that. Looks like he and his wife need an energy expenditure, the information, taking vital signs, and those other activities that have to be done. And then we'll, I guess, look at a medication education and changing his statin to Zocor. So, hey, Landon and Julie, could you kind of coordinate this discharge education?
Yeah, I guess.
Oh, so Katie, it's up to you to do the medication education with him.
Sure. That statin needs to be changed, though. Dr. Mayo, do you mind writing that order to change it?
Okay, if I can find the chart. Does anybody know where it is?
So, hey, Doc, we'll have to find that chart for you in a little bit. But, hey, Joy, I think that OT probably needs to do a final workup with him, and it sounds like this man's going to have a lot of problems with overcoming some barriers with his equipment and stress level and all that stuff. So, hey, it's up to you to do this final evaluation.
Okay, sure.
Hey, and Doc, I'm going to put a call into the dentist office today, and is there any way that we can reach you so that if they call back, we can convey the information?
I don't know if I'll have time today. I didn't even really have time for this conference. Just make sure the patient knows to get an appointment and to limit his nonsteroidal use.
Okay, thanks, everybody.